My name is Ray Riley. I'm a professor at the Leslie Dan Faculty of Pharmacy and also the director of the Center for Pharmaceutical Oncology. The center is focused on the development of diagnostic tools as well as therapeutics, new therapeutics for cancer. And our mission is to advance the most promising approaches to clinical trials, working with the oncologists at the University of Toronto affiliated institutions. Dr. Gang Zhang is one of the world's leading nanomedicine scientists, and he has developed a new class of nanomedicines that are called porphysomes. And they're very versatile types of nanomedicines. They can be used for both imaging of cancer using various modalities, as well as treating cancer by applying light to the porphysomes. Dr. Gang Zhang and his colleagues at the University Health Network are planning the first ever clinical trial of porphysomes in patients with gynecological cancers to enable the evaluation of tumor and normal tissue distribution of the porphysomes in this first in human clinical trial at UHN. The CPO will be developing a copper-64 radio-labeled form of the porphysomes that would allow patients to be imaged using positron emission tomography or PET scanning.
So my mandate is to bring the benefit to patients. And Professor Riley also shared a vision. His completion of his cGMP facility is like music to our ears. And so as we are ready to make a first in human, the first step toward that is have to radio label the porphysome. And his facility is just the perfect match.
So the next generation of cancer researchers are our graduate students who are pursuing their master's or PhD degrees at the Leslie Dan Faculty of Pharmacy using the support of the CPO in their research.
My name is Tiffany Ho. I'm a PhD student in Dr. Gang Zhang's lab, as well as a trainee of the Center for Pharmaceutical Oncology. Specifically, what I'm looking at in my research is photodynamic therapy, and essentially how that works is the photosynthesizer gets injected into a patient or an animal model and allows it to circulate and then basically accumulate within the tumor. So once the photosynthesizer accumulates into a tumor, we could actually shine the laser and focus the treatment to only the tumor, activating the photosynthesizer or the porphysome within the tumor and locally treating it without causing any adverse side effects to the surrounding tissues or the healthy organs. The CPO, I think, is pretty essential because it basically operates as a facility that's almost like a meeting area or gathering area of a number of different cancer researchers as well as graduate trainees like myself. The facility itself also offers access to very sophisticated instruments that could also help to expand my research.
One of the reasons I established the CPO was to allow pharmacy and pharmaceutical science in particular to play a role in the development of these new diagnostics and therapeutics for cancer.
We are working a little differently because we drive our question from the clinical unmet need. And that's what the CPO's vision.